Hello everyone, my name is Nora and I will talk about the research behind acupuncture and what we can do with acupuncture, and I want to especially talk about what you can do yourself. Let's dive directly into this. Quickly about me, I have a background as a practitioner of Chinese medicine. I'm an acupuncturist and working with Chinese herbal medicine. I have my clinic in my hometown and Bonn, Germany, and I'm specialized on infertility treatments, and I've seen many women with endometriosis. I felt that this patient group is the patient group which needs me the most. And as you can only see so many patients a week, I felt that I wanted to do more and be more supportive. And I started doing research. And while I was doing research, I fell in love with doing research. And I hope that I can show you a bit why research is so interesting for women with endometriosis. A year ago, I took my whole family and came to Australia to do my PhD, and I'm currently running a research study with women with endometriosis on the efficacy of acupuncture for endometriosis. So when it comes to research, there are two broad areas. The one area is that research investigates what acupuncture can do to relieve pain symptoms, and the other big area is what acupuncture can do to improve fertility. I want to dive a bit into the nitty-gritties of research, and I hope that you can follow. It's a bit, sometimes it's a bit, we throw around a lot of numbers, so I hope that you will find it beneficial. Just to give you the main summary right away in the beginning, the main question is, can we improve pain and other symptoms of endometriosis, and can we improve fertility with acupuncture and Chinese herbal medicine? And the simple and quick answer is yes, we can do this. And I will support this statement a bit with the stats. So the first study, I only brought 5 studies, not to overwhelm you. And the first study I want to introduce is a most recent study, just published this year. And this is a systematic review and meta-analysis. And you must understand that research the reliability of research depends on how this research, or where this research sits in the research pyramid. So there are studies which investigate single cases. There are studies where different patient groups are and different treatment aspects are compared to each other. These are called randomized controlled trials. And then at the very top of these, there are the systematic reviews and meta-analysis. And this is research which pulls together the information from different randomized controlled trials to get a very broad answer. And from these systematic reviews and meta-analysis, you can draw conclusions about, can we actually have a recommendation for acupuncture and endometriosis, for example. So this is one of these studies which are the highest level of evidence we actually have. This is a research study, as I said, a systematic review and meta-analysis. And they put together 9 different randomized controlled trials with a total of 535 participants. And 5 of these studies investigated the pain symptoms of endometriosis. And to understand the stats, you must know that these pain symptoms are usually measured on a 0 to 10 scale. 0 means that participants reported that they have no pain at all, and 10 means that the pain was so debilitating, the worst pain they have ever experienced. So we have this 0 to 10 scale, and this is the typical scale they're using in research. And in this systematic review and meta-analysis, they showed a mean difference of minus 1.67. And you must understand this, if you have a 0 to 10 scale, then a reduction of 1.67 is not that much. So if I would if I'm in my clinic and I'm seeing a patient, and this patient has a pain score of say 8, yeah, and after the treatment or after a course of treatments, the pain reduces by 1.67 on this 10-point scale. That's not much. It's a bit more than 6. So we must understand that research and clinical practice are two different things, right? Because one of the main issues is that the dosage component in research is often not sufficient. Dosage component means that either the frequency is not high enough, or in research it is quite often that you have the treatments right away, only right away before your menstrual period. But in clinical practice, and I did a research study myself where I asked other expert acupuncturists about how they are actually treating endometriosis in clinical practice. They are all convinced that you need to treat endometriosis throughout the whole menstrual cycle and not just before the period. So when it comes to Chinese medicine, I always say this is a slow medicine. It's not like taking a painkiller where you take the pill and after a couple of hours you hopefully feel better. That's not how acupuncture works. Acupuncture works over time, so you need a couple of sessions over a longer period of time. And this in endometriosis, especially when it comes to severe cases, that can easily take 3 months or more. So if you are starting an acupuncture treatment, you must be aware that there are usually more treatments necessary. So 3 months is absolutely normal. When it comes to infertility, I usually treat my endometriosis patients until they are pregnant, and actually until they have finished their 12 weeks of pregnancy. So you would support these women throughout all this time. So that's why this research is good. The stats show that this improvement by acupuncture is significant, but actually this is not what we would call clinical relevant. Yeah? So the next study I want to introduce is a study I conducted myself with Associate Professor Mike Armour, which is my professor, my supervisor for my current randomized controlled trial. And this is also a systematic review and meta-analysis. We included 6 randomized controlled trials. This is quite similar to the one I introduced now, maybe a bit differently done. That's just how research is different from one study to the next. But you can see that the results are a bit better. So we compared, or we investigated the benefits of acupuncture compared to non-specific acupuncture on overall pain. That means on not only on menstrual pain, but also on this chronic pelvic pain which you experience not only during menstruation, but during the rest of the cycle. And we didn't use this mean difference, as I just told you, but Giese, and these results are actually quite good. A Giese of 0.8 upwards means that the benefits are large for acupuncture. So we in this systematic review and meta-analysis, we had very large effects in favor of acupuncture on overall pain and on menstrual pain. We had also one study included which compared acupuncture to usual care, and also the Giese was over 0.8, so also a large benefit for acupuncture. I would like to point out one randomized controlled trial, and this is because I think that this randomized controlled trial on acupuncture for endometriosis is the most interesting one. So they included 106 women and compared acupuncture to superficial needling, which is some kind of control acupuncture, and they offered 12 weeks of acupuncture. But again, as I said before, in research this is very common that they use acupuncture only before menstrual bleeding. They showed they had quite good results with a mean difference of almost 3 points on this 0 to 10 scale. But again, as I said, in clinical practice, I would actually expect better results than this, because we would actually treat throughout the whole menstrual cycle. And they also investigated the quality of life. This was a scale from 0 to 100, so about 20% improvement on the quality of life of these women. The next study, I just want to point out that acupuncture is usually not used as a standalone intervention in clinical practice, but you combine it with other techniques such as ear acupuncture or electroacupuncture, but I don't want to bother you with the details of the study. And the last study I wanted to introduce is the study which investigated the efficacy of Chinese herbal medicine when it comes to endometriosis-related infertility. And this is not a coincidence that this study is not about acupuncture, but about Chinese herbal medicine. Because actually when it comes to infertility, in my experience, it is often not enough to provide acupuncture. You usually need to add Chinese herbal medicine. So if you are looking for a practitioner of Chinese medicine, if you are aiming to get pregnant, then I would definitely recommend look for a practitioner who is also providing Chinese herbal medicine, not acupuncture alone, because you need this to improve the oocyte quality. And this systematic review and meta-analysis included 11 randomized control trials with more than 1,000 participants, and they compared Chinese medicine plus Western medicine versus Western medicine alone. And this is, again, very interesting because Chinese medicine is something you can combine very well with Western medicine. You don't have to make a decision. It's not like either you use Chinese medicine or you use Western medicine, but where the strength of Chinese medicine starts, there is this overlap where the weaknesses of Chinese medicine start. So you have the strength of Western medicine and the strength of Chinese medicine, they complement each other. You can easily combine them, and I would definitely recommend that. With this study, they showed that you could significantly improve pregnancy rates, and they could significantly reduce miscarriage rates. So definitely Chinese medicine and acupuncture can be beneficial when it comes to endometriosis-related infertility. What can we address? I don't want to go through all this in detail because I think it's just too much. Maybe just a more easy to understand explanation what acupuncture can do. With acupuncture, you actually have a slight injury in the body. And what the body is doing as a result or as a reaction is that the body tries to heal this, even if it's a very small injury, but with this little injury. And that's why the immune system gets activated to heal this slight injury. And as such, you can reduce, as a result, you can reduce inflammation. So acupuncture has the ability to reduce inflammation, and this can be shown by different pathways, which you can see here on the slides, but I don't want to go into the details of this, what it actually can do one by one. When it comes to endometriosis-related infertility, it is very important that we do not forget that women with endometriosis are usually experiencing pain symptoms. So we can't just focus on treating infertility. And from Western medical point of view, while they are trying to conceive, they can't take any hormones. So from Western medicine point of view, they are untreated at this stage. That's why I would definitely recommend to get acupuncture and Chinese medicine while women with endometriosis are trying to conceive, because they don't have any other options. And one of the great benefits of acupuncture is that it is not contraceptive, which hormonal treatment is. So when should you use acupuncture? The main reason I would, or the most important thing why acupuncture should be used is, as I said, when women with endometriosis suffer from pain symptoms and are trying to conceive. This is the very best option. I wouldn't necessarily recommend acupuncture alone or Chinese medicine alone as a standalone intervention without Western medicine when women with endometriosis are very young and when the time they want to have a baby is in the unforeseeable future. Then it might not be the best option because we currently don't know if we can prevent recurrence of endometriosis, and acupuncture and Chinese medicine, herbal medicine is unfortunately also not a cure of endometriosis. As you all know, endometriosis is a chronic disease and we do not have a cure, and also Chinese medicine is not a cure for endometriosis. So that's why I'm always a bit careful when it comes to very young women. So my youngest patients were 14 and it's very tricky to recommend these very young girls proper treatment, but acupuncture alone might not be the best option, especially not as long as we don't have acupuncture and Chinese medicine covered by Medicare. And then it's also a matter of time and money. So I would like to use the last couple of minutes of my talk to talk to you about what you can do yourself. And this is where I believe the strength of Chinese medicine really comes into the picture, because as Amy already pointed out, we have a bit of an other understanding in Chinese medicine how we understand endometriosis. In Western medicine, we just have one diagnosis, endometriosis. Maybe you can differentiate between a couple of stages. We can definitely differentiate between locations, but that's it. And in Western medicine, in Chinese medicine, we can distinguish between the different patterns you were already talking about. And this is especially helpful when it comes to what you can do yourself. So there are three main problems in endometriosis. The first is what we call dynamic problem. Like imagine a river which is blocked, and this blockage, this causes that the flow of blood is not smooth anymore. This is one of the typical symptoms women with endometriosis have, are these large blood clots in the blood. This is a typical sign of, we call it blood stasis, where the blood flow is not smooth anymore. So this dynamic problem, if you experience one of these dynamic problems or one of these symptoms, which you can read here, then your main focus should be on managing or getting these fluids into motion again, so that the dynamic is not blocked anymore. A second reason is coldness. Imagine a frozen river. Also, the flow of blood is inhibited by, in this case, by ice here, frozen. And this is something which is very, very, very typical in women with endometriosis, so it's often related to cold. And what you can do is not only, so what everybody knows is using heat packs or heat, and everybody would usually use heat quite intuitively. If it's helpful, women use heat. But heat is just one aspect. Other aspects can be eating regular warm cooked meals. And in Chinese medicine we understand that every food has a certain impact on the temperature of the body. So there's cooling food and there's warming food. Like, for example, imagine or think of mint tea, which you usually drink when it's very hot outside, because mint tea, even if it's digested warm, it has a cooling effect on the body. And on the contrary, there is food which has a warming effect on the body. So this is something which you can understand. If you understand your diagnosis from Chinese medical point of view, then you can understand, okay, what does it as a consequence, what can I actually do, which is quite likely to improve my symptoms. And the third big field is deficiency. Like imagine a river where there is just too little water inside. So if you use, we call it deficiency in Chinese medicine, if you're deficient, then of course the main thing what you need to do is replenish, fill up the sources, that the blood is more again. I will go directly to the next slide. So, as I said before, I've treated a lot of women with endometriosis in my clinic in Bonn, and now I'm researching acupuncture for endometriosis with a very ambitious goal to finally get a recommendation for acupuncture in the clinical guidelines. But I noticed that the self-care measures are one of the biggest things women with endometriosis can do themselves to feel back in control. That's why I founded my EndoCare. My EndoCare is a program over 90 days where we use the individual diagnosis of Chinese medicine to get an idea and understanding of what's actually helpful in your individual unique case. So if you're interested in that, please let me know. We will have a chat later on. Thank you very much.